Epilepsy surgery. How does intracranial EEG work? Imagine trying to find a tiny spark that causes a big fire in a dark room. That's similar to what intracranial EEG does for epilepsy. It helps doctors locate exactly where seizures start in the brain. This process is crucial for planning surgery that can help control seizures effectively. When non-invasive tests like scalp EEG or brain scans don't give clear answers, intracranial EEG becomes the next step. It involves placing special electrodes directly on or inside the brain to record electrical signals over days or even weeks. This detailed monitoring shows the precise spot where seizures originate, which is essential for safe and successful surgery. There are two main types of electrodes used. The first is called subdural electrodes, which are flat strips or grids placed on the surface of the brain. To do this, a small part of the skull is temporarily removed in a procedure called a craniotomy. These electrodes are ideal when seizures seem to start near or on the brain's surface. The second type is depth electrodes, also known as stereoelectroencephalography or stereo EEG. These are thin, needle-like electrodes inserted through tiny holes drilled into the skull. Using advanced imaging like MRI or CT scans, doctors guide these electrodes into deeper brain structures or areas on both sides of the brain. Depth electrodes can record from multiple regions at once, giving a comprehensive picture of seizure activity. The procedure is performed under general anesthesia by a specialized neurosurgeon. Once the electrodes are in place, the patient is moved to an epilepsy monitoring unit. There, continuous video and EEG recordings are made to catch and analyze seizure activity. This helps confirm exactly where seizures start, identify critical brain areas involved in functions like speech or movement, and plan the safest way to remove or disconnect the seizure focus. Monitoring typically lasts from a few days to several weeks, depending on how long it takes to record typical seizures. After enough data is collected, the electrodes are carefully removed, and the medical team reviews the findings to decide on the next steps. These might include removing the seizure focus, implanting devices to control seizures, or continuing medication management. While intracranial EEG is a powerful tool, it does carry risks like infection, bleeding, or neurological deficits because it involves brain surgery. That's why it is only recommended after thorough evaluation by an experienced epilepsy team. In the end, intracranial EEG helps doctors pinpoint the exact origin of seizures with high precision, making epilepsy surgery safer and more effective. It offers hope for many patients by providing critical information needed to improve seizure control and quality of life. Always remember, each person's situation is unique, so discussing options with a healthcare professional is essential for personalized care.